ndibabaza okwenzileyo Nkosi umhlaba lo osenzele wona.
One of the biggest barriers or challenges I faced with other people, especially asylum seekers, is the language barriers and how to access NHS. It's easy for me because I understand the culture of NHS, how it works, but for someone who just arrived in the country from the different background, it's quite difficult to understand where to go and how the system works and where to apply. Just be patient and just listen. The main thing is how to listen and where to talk, when to talk actually. That's the main thing. So because sometimes because of their experience, they want people to understand where they're coming from and why they are so frustrated or even happy, to share their happiness. And then you just listen and then bring the feeling back to them and share that good or bad feeling with them and try to help it through them.
I would like to discuss about the talent we bring and what we are going to do with that talent when you're waiting. So it's just like more of it, it's a waste. I am qualified psychologist, I am experienced banker, I am trained interpreter by now, but I can't use any of my degrees, I can't use any of my talent, I can't use any of it. And in reverse, what is happening, I'm losing everything. I'm losing my confidence, I'm losing my ability, I'm losing my motivation to work for. So I'm losing everything. I'm losing this year where I can really, like struggle in any of the field and I can prove my level best in any field I would work in. But definitely after a few years, I'll not have that energy which I have now because of my age maybe, or because maybe circumstances. Because my mental health will be so bad after a few years, not working, not having money, not having lots of resources to me and my son. So, that's going to add up. I'm not going to be the same person if you meet me next year.
Well, and I had this friend who asked me, well, in my head, I wanted to go to the emergency room, but I got this friend who, who told me that first I needed to go and register with our GP. And for that, she said I will need my passport and stuff like that. Well, the first thing that came to my head, it was like, how would I go and register? I don't even speak English. So I had no idea how to do that, but she offered me to go with me. We went, I wasn't much aware of how we did that. I just remember taking my passport with me. And I remember when I went and we put all my details in, the doctor gave me, one of those tubes for the urine example for the first assessment. And he told me I was pregnant. And it was quite a shock. It was really a shock because I was here already for 3 months. So I was about 4 months. So the shock was really big and I had no idea what to do. And the only thing I remember in my head, it was the GP giving me this folder and telling me when the baby was gonna be born. And also, just give me a few dates for scans and stuff like that at the hospital. So that's it. I think I never had a midwife until now. I'm not quite sure what they do. I think they're just nurses for pregnant women, but not quite sure what they do. And I remember, I know I don't know what a midwife is because I never had one. Even when I went to the hospital to have the baby, for me everybody was either nurses or doctors. And the whole idea of asking for an interpreter, it was, in my head, it's like if I ask for anything, they might charge me for it. So, because I didn't know how it works.
During the pandemic, it's very, very hard because we're just staying inside the house without family, because for us it's a very problem, It's too hard. We don't have a data and we don't have a phone. So if I don't have a phone with me, it is very hard, difficult for me, because we are just staying inside one room and no family. We doesn't have any family in here, so it's very difficult for us.
And every minute, apart from the horrible pain that is having a baby, not having someone to be there to interpret it or to tell me in my language what was going on, it was just, it just put that extra pain on me, I would say, because in my head, like, it just, I don't know, I suppose it just seemed so easy when my mom had babies. It seemed so easy, and I couldn't bear it by myself. I had a friend who would come in and out every few hours when she wasn't working, but that was not really enough, I would say, because even her would come and talk to me and sometimes talk to the doctor, but in a very broken English. So herself wouldn't understand very well what the doctor was saying, so let alone me. And it was very distressful.
Living in a 35-pound, it's like, it's embarrassment. When you are somewhere in the market and people are saying, oh, it's just 30 pounds. Seriously, for them it's nothing, but for us it means a lot. It's our almost 1 week living, in which we have to, if we will use a bus, we have to think about that. Am I going to use the bus? Or so I have to sacrifice for one day my age.
Oh gosh, my name is Emily. So originally I was born in Zimbabwe, but I moved from Zimbabwe when I was, not move, that's not a right word. We flee from Zimbabwe when I was 13 years old. And at that time I was, due to what was happening in Zimbabwe, I was pregnant. So I stayed in South Africa because we flew to South Africa with my uncle, who was a politician in Zimbabwe. So I stayed there, I finished my high school there, and then I trained to be a teacher. I went to the university and I started teaching. And then while I was teaching, I think after 4 years as a teacher, qualified teacher, my uncle was killed in South Africa by people from Zimbabwe. So I had to flee South Africa. When I flee South Africa, I didn't know that I was coming to UK to stay. I was just assisted to get the papers to come to UK, and at the time I came, I was hoping I was going to go back to South Africa because that is where I had my son and my work, my everything. I had already started building up my life. Came to UK, I didn't claim asylum straight away because I didn't know what asylum was and what asylum is. I just became stranded, and then from there I started working, which I was helped to work. I didn't even know what to do, so the person who helped me didn't explain much, and I didn't know much about the system in UK, so I was arrested then. So when I was arrested by the Home Office, because they came to the workplace, that's when I knew the difference between the police and the Home Office. So after that I went to the police station, the actual police station, and the Home Office officer came and asked me questions. So I narrated my whole story, and then she was the one who told me that my case was an asylum case. So my asylum seeking case started from then. But unfortunately, it took a long time. In short, it was 12 years, 2 months when I didn't have a status, and I was in limbo, and I was depressed, and then a lot of things happened, sad things happened. People died at home and I couldn't even go, including my only son that I had when I was 13, even though at the time he was no longer a baby. He was a young man, he was at the university. So I needed to go back. At least I was hoping if I could go and bury my son. I couldn't go because they said, you didn't have any status we can't send you to South Africa, we can't send you to Zimbabwe. So I stayed. So when I was at the low of my lowest, another person helped me, told me about a place called Pafras. So that is where I went, and then I got to know about the Refugee Council.
You know, to be honest, the system, because we are just staying here without work, and because we are not working, we are not allowed to work at the moment. So if we get little permission to work, we might be little, you know, help to asylum seeker, which is, you know, because we just staying at home and, you know, getting like depression too much. Next future, actually, in the near future, will be the chef. I'm just doing a chef job. So I'm a chef, to be honest. So I just didn't want to be a Turkish chef.
Ibrahim, just explain that you've received 3 letters.
Yes.
Just said 3 letters to say you're going to move, and you've never.
Never,
moved.
I never move. I'm there. Yeah, 3 letters. I have 3 letters.
And how does that make you feel?
I feel that they are not sleeping. When I see, they say next week maybe you people will not going. So I see, I can't sleep. When I go to bed, I say no. This life, when I free, this life, when I can't sleep. I can't sleep. So, and one thing also they say to me, I called yesterday and helpline. I told them they give me £40. Yes, before £9. So after that, they give me £40. This £40 now sometimes 37.50, sometimes 37, sometimes 39. I told them this is a rule or it's a mistake or what? I want to know why was this one happened yesterday. So I talked to helpline about this. So about this thing, I don't know. Because when you go that, maybe go sometime, maybe £1. It should be left £1. I don't know. Because of 39, 40, 49, 30, 38, 37, maybe it's going to £1. That's why I asked.
You don't know how
This,
much you
yeah,
do it with.
yeah. So that's what I asked yesterday. But they say, they find out, I say, okay, no problem.
Okay, I think that is amazing.
Yeah.
It's been really helpful, and we haven't had anyone else from the hotel, so it's been really useful to have that sort of experience.
Yeah. Like a lot of different. Me, if I know you need a lot of people, I can tell the people come in.
Oh my God.
Yeah, I can talk to them. Come.
If you want to hear about the transfer letter, dispersal letters, oh my God, we have a lot. They praying to God all the time to get the letter. My experience totally different. I got 4, but I declined the transfer for some reason.
Maybe hotel, some people, maybe they like it. Some people, because we know, some people, they don't have life, they never get life. They never, so they want to sleep. They don't want to go doing nothing. Some people maybe, but
If you don't know where you're going,
if you want to do,
And the quality, quality of the houses, you know, even we have very bad experience with my friend, and from this point I decided now to stay in the hotel better than going somewhere we don't know. To share people, I mean the mentality, the lifestyle, totally different. The cleanness, is the house ready or not? And you don't know. Even you don't know what is your right to refuse or.
When I entered the UK, like at December 2019, I was accommodated in a hotel, and HARP Group came to the hotel to introduce us to the HARP as a project, which is trying to introduce refugees and asylum seekers to the healthcare system in the UK. Had a project, had a meetup in there, and I participate, and I immediately liked it, and I started to learn the system. I started to do translation for my compatriots in Farsi, for them to know how the system works here. Actually, everything was new for myself, so it was an experience for myself. It was a learning experience, and at the same time, I did translation, and I asked Rose, the project manager of HARP, if it is possible to do voluntary activities there, and she accepted, which is a great thing, because I thought maybe as an asylum seeker who come across as someone who is vulnerable and not ready to do anything and just need a healing process. Actually, she accepted me as that, and I had like a short training course, and I started to help right away, which was wonderful experience, and it still is. Actually, I'm doing that.
I just want to say everyone to understand our refugee or asylum seeker how hard living in the UK, because they just, you know, they have no choice. They have to wait, because we are run away from our country, which is, you know, because of the war, of the problems and any kind of reason. But you know, we are here. They have to understand our, you know, we are here because of some reason, and this is how hard life for us.